So today we'll be talking about the diseases of the gallbladder. So what is the gallbladder? Gallbladder is basically a storage organ of the bile which is produced by the liver. So what happens when you have some kind of disease associated with the gallbladder? The commonest diseases are usually stones or some polyps. What are the symptoms? The symptoms might be pain, there might be nausea, vomiting sometimes, there can be hyperacidity or recurrent acidity symptoms, or there can be pain in the right side of the upper abdomen. In extreme of cases, there can be the presenting symptom of jaundice, ज्याला मराठीमध्ये कावीळ असं म्हणतात. So that also can be one of the extreme symptoms. What should you do when you have these recurrent symptoms? Consult your doctor as soon as possible. Make sure that a sonography is done, and after you get the sonography done, depending on the results, if there are stones in the gallbladder associated with all these symptoms, it is always better to go ahead and get it operated as soon as possible. Also, one of the risk factors is having diabetes and blood pressure at the same time. So if you have diabetes and blood pressure along with stones in the gallbladder, it is always better that you get it operated as soon as possible, because this can lead to further complications if left untreated. What are the treatment options for a gallbladder surgery? So usually laparoscopy and open are the two methods that you can tackle the gallbladder. Laparoscopic surgery is now one of the gold standards for this kind of surgery, wherein it is a very quick and safe procedure which is done through keyholes or small incisions, usually 4 of them. And once this surgery is done, you can be up and about the very next day, walking and even resuming your normal daily routine. Versus for open surgery, the recovery time is quite significant, which amounts to almost 10 to 15 days of rest, and after which also there are restrictions that need to be followed.